Tiernan's going to deliver a topic of driving energy efficiency and performance in the health system. Most people here, I would imagine, would know Tiernan. He works for the Department of Health and Human Services, and since 2008 he's been the Manager of Environmental Sustainability at the Department of Health and Human Services and provides sustainability leadership to the state's 87 public health services. During his time in his role, the total water use has reduced by close to 1 billion litres, energy intensity per square metre and occupied bed days have reduced, over 1.5 megawatts of solar power has been installed, and over 90% of health services have an environmental management plan. So without further ado, we'll get Tiernan to come up and tell us how we're going to meet our net zero by 2050. Thank you.
Thank you. Alright, how are we going to meet net 50 by net zero by 2050? We're going to bring the grid, aren't we? Ben?
Pregnancy care centre, bed 1, obstetric unit.
What am I going to talk about? I'm going to talk about a few things. The Climate Change Act, very briefly, which has been enacted by the Victorian government. Talk a bit about health system energy performance, a bit about the Green and Government Buildings programme, which is energy performance contracting, a new tool called Neighbours for Hospitals, which Jude and I have been working hard on over the past few months. A bit of work I'm involved in. I had the first kick-off meeting yesterday, which is the whole of government marginal abatement cost curve. Then talk a bit about financing energy efficiency and also using environmental data to track performance. So this is where the net carbon zero by 2050 is in. It's in the Climate Change Act. There's also a target of 15 to 20% below 2005 levels by 2020. That's across Victoria as a whole. The department is doing what are called carbon reduction pledges, and we also have to have a 5-year emission reduction plan by 2020. This is all in the legislation. Also from 2020, larger government organisations will also have to do emission reduction pledges and have carbon reduction plans. I've done a bit of a think about which ones they will be based on the thresholds that are floating around government, and if you're a large metropolitan health service, you'll probably be within that threshold. There's about 20 odd health services that will have to have a 5-year emission reduction plan and an emission reduction pledge. The department is also preparing an emissions reduction plan. It's out for tender at the moment. It's looking at our whole portfolio, so sport and rec. So we've got what MCG, Olympic Parks, the aquatic centre, high-rise public housing, the department offices, and of course public hospitals. So that is work underway. But quickly, I'm going to go to this slide first. So this slide here shows energy costs, which have been increasing. A slide not dissimilar to what Ben had. You can see here those two peaks there are the carbon price. But if you look at the blue line across the top, that's our actually energy usage trend that hasn't really changed. It's around 4.5 petajoules across Victoria. and you can see the majority of our load is electricity. We've got a little bit of steam from our 36 megawatts of cogen across 5 big hospitals. Those poor hospitals that aren't on the gas network have to use LPG, so we've got a little bit of LPG, and then the last bit down here is gas. This is all converted into gigajoules. Last year's bill was about 80 million. If what we hear, if the higher prices eventuate next year, may well be up the top of the graph. Now, if we just go back here to, but how are we performing in terms of energy efficiency? So here we have, this is just averaged across the whole system, doesn't account for different types of hospitals. We can look at the top one, 2.73 gigajoules per separation, 1.42 gigajoules per meter squared, and if we look at bed days, which is any inpatient bed days occupied at midnight, that's pretty much flatlining at about 0.67. This major drop here in meters squared isn't because we've become incredibly more efficient, it's because we expanded our reporting scope. We used to only collect data on the large hospitals. We now collect data on all of our hospitals. And so our meter squared has increased, but that extra meter squared we have captured isn't as energy intensive as our larger hospitals. So hence that drop. So, Green Government Building Programme. Here, who's heard of the Green Government Building Programme? Yes. So this is built on energy performance contracting, which is in effect a loan from Treasury, which will invest in anything. It used to be 4 years, then it was 7 years, now it's 5. So we'll invest in anything with a 5-year payback. In terms of funding, the funding is dictated by Treasury. We put in a bid for a large amount of money in the 17-18 budget. You can see here we got an extra 10 million, which is about 1/10 of what we asked for, but you can't really say no thanks, I don't want 10 million. So the value, we've got confirmed funding of around 25 million since 2015. The problem here is not knowing what to do, it's having the funding to actually go and do it. So we've done a lighting retrofit at the Austin. We've done an energy performance contract at West Gippsland, which is about 5.8 million. It's saved quite a lot of electricity and quite a lot of gas. We're very close to signing a contract for Peninsula Health. We have allocated 7 million. It may be not that much. We are working with another metropolitan hospital on a $5 million one that we've got funding for 17-18. We'll be hopefully going out in late 2017 to do energy efficiency in solar across all of our Gippsland hospitals. We've got 3.5 million for that one, and then early to mid 2018, we'll be going out and doing some more regional hospitals. The key thing we've heard back from the regional hospitals is they want to use regional suppliers, especially Gippsland, because of what's happened down there. So there is a big push to use regional suppliers, which may not be the new some of the metro suppliers want to hear, but that is what the customers are saying. So Ben talked about solar, and as Mark mentioned, we've got about 1.5 megawatts in the system at the moment. And with the 300 kilowatts that's happening at Sunshine, and there's also 260, 300 kilowatts happening at Sail, that's going to bring us over the 2 meg mark, which will be really exciting. The department and HPV are working on bulk procurement of PVs for the Gippsland area, where we actually look at purchasing across all 10 hospitals down there to get the best price we can. And if that is successful, we will then be rolled out across the other regions. And if the two metro energy performance contractors align, we can potentially look at including those hospitals as well within that bulk tender. So if you are purchasing solar, do let myself or Jefferson know, and then we can think about how we actually, if we can fit that in. I also get a lot of calls from hospitals about batteries, and can we link batteries to solar? Here we've got a 99 kilowatt array. The top one is at Yawonga. This one here is 289 kilowatts at Wagga Hospital. Neither of them export. It's all used on site because the demand is so high. So therefore, to put batteries in to link to solar, you would need to massively oversize your array to get the export capacity to actually put it in. So there's not really, at this point in time, I think, the commercial viability of linking solar to batteries. You could put in batteries potentially if there's a big price differential between your peak and your off-peak, and you charge your batteries during the off-peak and then you drain down in the peak. At the moment, that price differential isn't quite there. The other one we are potentially looking at is we've all got big diesels, we've got UPSs. Could we look at commercial scale batteries for security supply? Again, the batteries would just be sitting there. If you're using them for security of supply, you don't want to use them for demand side management because you run them down, the grid goes down, you've got no security of supply. So we're still unsure about what role batteries will play in hospitals, but I think there possibly will be a role for them sometime in the future. Okay, the next one is neighbours. Who knows what neighbours stands for? Not you, Julian. Nasty Australia, though.
Just the National Australian Built Environment rating.
Yeah, that's it. So this is the health the Victorian Health Department and all the other health jurisdictions got together and said, why can't we have neighbours for hospitals? We now have neighbours for hospitals tool. It took about a year and a half to agree to build, to test. I think, was it yesterday, Julian, we closed off the 15-16 data. So now we've got a complete 15-16 data set for all of our hospitals and all of our aged care homes. So we will be, the next few months, doing Neighbours for Hospitals rating for all of our hospitals and aged care homes. So this hospital will get a rating, as will. It's basically the way the algorithm works, it is on carbon and water per bed day. So if you've got an inpatient bed day or if you've got an aged care bed day, it will get a rating. 15-16 ratings we hope will be sent out mid-2017, next couple of months. And then we'll then start on the 16-17 ratings. The key issue we have had is we need a complete data set for electricity, for natural gas, for LPG, and for water. We're only allowed to estimate under the neighbours rules 5%. So if you've got above 5% estimation, we can give you a non-verified neighbours rating, but you can't actually call it a neighbours rating. And it will come to a point where we haven't got the time to chase people down for that bit of data. So if your data's not in there, you're not going to get a rating, which is not our preferred scenario. We have yet to make a call on if we are going to mandate the publishing of neighbours ratings. So at the moment they're just being provided to you for info. Over time you would think that they would be published. There is a requirement for all commercial offices to have them. All Victorian government department commercial buildings we work out of have to have a neighbours rating of, I think, 5 stars or more. I would think we could have a fair number of hospitals, around 3 to 4 stars. The 4s and 5s will probably be less frequent. Marginal abatement cost curve. Anyone know what the marginal abatement cost curve is? How it works? Yes, Ben? I should hope so. This is just an example. So you can see, I'll go over here. You can see down here, so this is, these are the ones that will give you a commercial return, so it's worth investing. This width here gives you how much carbon it will actually it'll actually abate. And those ones up here, they will still abate carbon, but they are more expensive. So I'm involved in a project to do a marginal abatement cost curve across the Victorian government as a whole. And health is the largest contributor of carbon across government, about quarter. The next biggest is the Water Corporations at 22%, and then Rail at 21%. And the rest of it is schools, 7%, arts, the offices, TAFE, police, public housing, street lights, and etc. So this project will be completed towards the end of 2017. The intent is that this will then be used to prepare business cases for how government can work towards that net carbon zero by 2050 target. So this is a really exciting project. Okay, what everyone wants to know about how do we finance energy efficiency? As I said before, the issue in health is not knowing what to do, it's about how to finance it. Because of government accounting rules, hospitals and any other public sector organisation cannot take out third-party finance. That includes PPAs, it includes finance leases, all those kinds of things. They all contribute to net debt. Net debt has an effect on the state government's credit rating, which means it is something we need to work through on how do we actually finance it. And this is perhaps why EPC, or energy performance contracting, is so big in places like America, because there is no restriction on third-party finance for the public sector over there. They also have a little red thing at Times Square that shows you how fast national debt is increasing. So there is probably a correlation there. So there's two main ways we can do it within the Victorian government and most public sectors. 5 minutes to go, I think we've only got a few more slides. Green government buildings on the left-hand side there. 5-year payback, we look at the whole organisation. The timing is linked to how much funding we can get from Treasury and also how we roll it out across the state. Savings are guaranteed, but they're used to repay the loan, so you don't get your actual return until your 6th year when the loan is paid back, and you can generally see savings across the whole organisation. Self-financing is generally built around what the hospital has. It's generally tied to a project like solar. The timing is dictated by the hospitals. The savings aren't guaranteed, but you do get them immediately. But they may not be entirely visible across the whole organisation, depending on how big that specific project is. I'm happy to talk about that a bit more in questions. Environmental data. So we've got the whole of government, the whole of health system environmental data management system. So this is measuring performance here, and here you can see this is actually the one on the top is 15-16, the one on the blue is 16-17. This is where we have done an energy performance contract, so you can see there has been a significant reduction in electricity, but you also see up here it's gone back up to what it was the year before. So you can begin to look at why has that happened. You can go back and actually interrogate. what is happening. All right. So thank you. I think I've got 1 minute to spare.
Well done.
2 minutes. So yes, I'm around all afternoon, as is Julian. Do we have that laptop?
Yeah, I can get my...
Yeah, no, so if people want to go into their environmental data management system, we're not too sure what it can do let myself or Julian know, and we can get access.
Set it up over here, huh?
Yeah,
Thank you.
thank you.